TB stigma in Zambia is a problem because of the high prevalence of TB HIV co-infection and the association with HIV when people are more susceptible to contracting TB means that there are a lot of underlying assumptions in communities and myths around how you contract TB and its association with HIV. Obviously there's moral issues involved where TB and HIV is associated with particular social behaviours like sexual promiscuity or with particular groups such as migrants or minors, and with poverty to a certain degree. So it's an increasing problem as Zambia tries to tackle the co-infection of TB-HIV. Well, I think the main implication is that people don't seek treatment because there's misconceptions about TB and a lot of fear about TB as well. And this means as well people aren't getting the support from their families or health workers for many of the same reasons. Actually, it's been found that health workers do stigmatise people with TB as well. And because TB is an airborne disease, this can lead to people being isolated and excluded from society. So those are the main implications. The Anti-Stigma Toolkit is a community education programme whereby members of ZAMBART and Care International have trained community facilitation teams to go out into their communities and address some of the knowledge gaps around TB and stigma, really to identify what is stigma as well. One of the main focuses of this is to work with mixed groups, so say health workers and patients together, with the aim of increasing dialogue and trust between these groups to try and combat some of the stigma in the process, as well as using real-life scenarios to train people and make them more aware about some of the myths around TB and how to combat stigma. Since we started the project, we've trained 300 anti-stigma facilitators in 6 provinces of Zambia who are rolling out these anti-stigma messages in their communities and really acting as agents of social change themselves. And beyond that, really, the toolkit is contributing to a shift in the TB world towards looking at patient empowerment and patient agency, at the same time as it is very much a tool for training health workers in health facilities to deal with this issue.